the aspects of the policy, because all of the mandates on the doctors and hospitals and insurance companies cannot possibly be covered and those costs absorbed unless you have a steady stream of mandated, in some cases involuntary, buyers of the product. Okay? So it's going to be very difficult to repeal this policy if insurance companies in general, the only reason they have to support it is that mandate on purchase, because you're driving customers to their door, right? Now what we will find is that in order to cover those additional, and this has already happened, Blue Cross and Blue Shield of California have already raised their premiums. Maybe some of you have already seen premium increases above and beyond what you normally would have seen with your health. The insurance companies are responding by increasing premiums already, okay? Because they know that as long as this policy is enforced, as long as that individual mandate to purchase insurance remains in effect, they have a steady stream of customers. If you've got a seller of something that's got a steady stream of customers, they're not going to worry too much about what they're charging you. Okay, and then again, I can go back and give you an example from Tennessee and Massachusetts. Okay, Tennessee and Massachusetts have much higher, bigger increases in higher health insurance premiums and spend more on Medicare and Medicaid on a state-by-state basis than any other states. What's unique about those two states? They have a plan that is very similar to the plan that we are about to experience here in the next 3 to 4 years. Okay. Another group of people. I'm treading on thin ice here because I know I'm going to be followed here by someone from the insurance industry and someone from the medical industry here, but I'm going to lay this out to how I see it anyway. I think doctors and hospitals are also going to be very reluctant to have this policy repealed. Doctors and hospitals are benefited by having a steady stream of customers who are not price conscious, who do not ask questions about how much this test is going to cost, who do not ask questions about what are my total costs of an overnight going to be here versus what they will provide me in another city or another hospital somewhere else, or what another doctor will provide. Okay? If you are selling a product, whether it be health care or anything else, the best situation for you is to have a customer that doesn't care what the price is. Okay? Right? Business people out there, you know this, right? That's, in economics we call that, the consumer has a very inelastic demand curve. They're not price sensitive. Okay? This policy doubles down on 50 years of price insensitivity in healthcare markets, okay, where consumers are not price conscious because either the government is paying or a third-party insurance company is paying. That third-party insurance company, by the way, is subsidized to pay for your health care through tax deductibility of employer-provided health insurance premiums. Okay? Policies create an environment of third-party payers, of customers of a particular product, in this case it's health care, who are largely insensitive to price increases or decreases. All they care about is what they're paying their premium, what their deductible is. Maybe a little copay. Outside of that, they don't care. They don't ask, right? Okay? If you create more of that, and this policy does, in my view, creates more of that, it's going to be very difficult to get those providers of a service to customers who are insensitive to price to back a repeal of it. It'll be very difficult. Okay? Doctors, hospitals, all other healthcare providers that rely on taxpayer subsidy or forced third-party payer subsidy for the consumption of their product, that ensures demand for their product. You see what we're doing? We are ensuring demand for health insurance product and medical services. Okay? As a result, they're going to be reluctant and say, wait a minute, if you repeal this, that could potentially take away customers. Right? Yeah, it's got a lot of regulations in it, and it's got a lot of costs that I have to bear to comply with all the mandates here. And some of them will say, it's just not worth it. But in general, I believe, overall, it will be very difficult for both health insurance providers and health care service providers to come out and be fully against this, to get back to a market in healthcare, a market that is not distorted by government subsidy, that increases artificially the demand for the product. So, let's look at what PPACA does not do, and then we'll look at what it does do, and I'll wrap up here. It does not ration healthcare directly. Okay? There's a misnomer that that this is a government takeover of healthcare and the like. It could lead to that. but it's not there yet. Okay? It does not directly cap healthcare prices. Okay? It does subsidize some health insurance prices, okay, for some people. Like I said, it's not going to cap health service providers or health care provisions itself, but it does cap what insurance suppliers can price how they price their product. As I said earlier, the healthier are ultimately going to be forced to subsidize the less healthy, because all of them are going to be paying the same premium. And that means the less healthy are going to be paying a lower premium than they otherwise would be, and the more healthy are going to be paying a higher premium than they otherwise would be. Okay? It does not directly mandate a public option. Again, in my view, I believe it will eventually lead to that, or could potentially lead to that. Okay? I do not believe it will accomplish its intentions of lowered costs. As I've tried to demonstrate, if you increase the demand for health care, and then at the same time restrict the supply of health care and the supply of health care insurance, which I believe this policy does, you will see prices rise. Now, as prices continue to rise, what do you think the political atmosphere will be? I'll submit to you that I think it will be a further outcry against healthcare markets. I'll say, look, we tried to intervene, we tried to do it this way, we tried to leave some market aspects in. This has further increased the price of healthcare. I think the public outcry will be, well, look, prices are still going up, much as they have been in Massachusetts and Tennessee, where this basic plan is in place, has been in place for 5 or 6 years. And the outcry will be, cap those prices. Push those prices down by law, by fiat. Okay? Well, any economist will tell you, if you push prices below the market clearing level, or supply and demand dictate, you will end up with a shortage. Okay? This is what I believe that the law will lead to. And by the way, as I'm wrapping up here, I should just mention, I sent a copy of this very presentation to Jack. He has it, and he would be happy to make it available either digitally or in hard copy format to any of you who requested. If there was something on the slide you didn't pick up or you want to go back and look at, I am perfectly happy to supply you, or Jack will be happy to supply you as well. So feel free to request that. I'd be happy to email you a copy of this presentation. Now, this is a discussion that has not touched upon how this policy affects spending, what the CBO says it will do, what I believe it will actually do, what other economists have predicted it will actually do to spending, how much it will add to our budget deficit in coming years, how much it will add to the national debt, what the effect of that will be on long-term economic growth. That's the macroeconomic aspect of this policy. And I told Jack earlier that would take me, if we were really going to discuss that, I'd have to have me back for another presentation. That's a whole other aspect of this policy. But what I've tried to do here is show what I believe to be the microeconomic implications of this policy based upon theory, economic theory, my training as an economist, and based upon what we already know, the experience of both the Tennessee and Massachusetts programs that are very much similar in nature to this policy. Okay? So this is basically what we see here as I wrap up. I believe, bottom line here, if you can see that bottom bullet point, I believe that this policy lays the groundwork for further government control. It's not, at this point, what we would call nationalized health care. Many are fearful of nationalized health care, socialized health care. We don't want to go the way of Canada or Europe or whatever. But I leave you with this. I believe the policy will eventually, and in some respects inevitably, lead to that, because I believe that it will crowd out, in part, the private sector, increase enrollment in these exchanges, which will ultimately, I think, channel people more into Medicare, Medicaid, government sector provision of health insurance. And through economies of scale, insurance companies, health practitioners, hospitals merging and growing larger, I think it will be